Thank you very much, Faisal. Thanks for having me along. As Faisal said, ex-Microsoft, so I basically built the partner ecosystem in Europe for Microsoft HoloLens. So that allowed me to get introduced to a number of startup partners across different industries, as well as integrators and global ISVs who built solutions for the platform, including volumetric capture, which we heard from in the last session from Dimension Studios. All the way through to healthcare partners who I'm going to talk about today. Got heavily involved in healthcare, particularly at the start of COVID. Like many of us, we tried to do what we could and actually worked closely with Leeds University at the time, where we did a lot of capture of OSCE stations, and we also used the technology for helping with ward rounds. I'll touch on some of those use cases as well. Helped found the Holo Medicine Association. It's an independent body based in Belgium. The idea is that it's a best practice and also looks at policy and regulations in the space on how we use this technology for medicine. And if you're interested to know more about that, please see me afterwards. So I'm going to just jump into the presentation. Full transparency, as Kiedimi, I'm working with a lot of startups, and I'm going to be talking about some of them today. So although there's other companies who are doing similar work, I'm going to focus on some of the ones I'm working with. I'll touch on some of the others as well. But so let's firstly start off with a definition, which I think everyone in this room is probably familiar with, and you could maybe even argue with me if you like. But we said extended reality is really a continuum from the physical world all the way through to the digital world. So on the left-hand side, what I call augmented reality. So it's looking at digital information through a 2D screen, which overlays on the real world. On the right-hand side, full immersion with virtual reality. And then in the middle, mixed reality. So mixed reality is where we're blending the physical and the virtual world. So you're actually putting digital information in 3D or not in the world that's persistent, that you can actually walk around, you can interact with. So it's blurring the line between physical and virtual. And the type of devices in that space are typically the HoloLens, but also Magic Leap is another example. Virtual reality devices like the Meta and now the Apple Vision Pro are starting to blur the lines, actually, because they're looking at mixed reality through pass-through, and the quality is getting better and better. So in the Apple Vision Pro, for example, it's 8K per eye, and it's almost like you're looking at the real world. So it's interesting to see the lines blur there. So there's a lot of investment in this space. These figures are a little bit dated now, but looking at latest research, it's still similar kind of investments going on in the healthcare industry and in the provider space, particularly around education, but also increasingly in operations and particularly surgical planning, which I'll talk about. Also the pharmaceutical and the medtech industry are investing heavily in this space as well. So what are the challenges? Particularly in the surgery, you're working with 2D images, typically, even though it's starting to reconstruct those as 3D. But you need to be very experienced to work with that information. And it's difficult to spot anatomical variations, even for the most experienced surgeons, and then being able to actually refer to that information interoperatively. So this causes human error and risks, which has an impact, obviously, on the patient outcomes and obviously costs to the medical system as well. Another huge challenge we're all acutely aware of is the staff shortage, and this is across all industries. As you know, we have a retiring workforce, and the challenge is recruiting and training the new workforce. WHO talk about a 10 million shortfall by 2030. Just in the UK, I believe there was 40,000 nurses left the system last year. So, yeah, there's a huge challenge there in training and providing high quality training experiences for those incoming. I know that the UK is investing in opening new medical schools. So, how do you do that quickly and give all those students high quality training? Not only students, but even professionals in terms of training. You don't always get a chance to experience certain surgeries or certain procedures. So, how do you keep up to date? How do you practice? Third area is collaboration. So you want to be able to access the expertise wherever it is. MDT is becoming a standard practice. So how do you facilitate those MDTs in a rich way and bring in the experts wherever they are, whether they're in the same hospital or they're on the other side of the world? Also talks to access, being able to access the best quality care wherever you are in the world. And then the last area is more around infrastructure. So this is quite topical, with the data privacy breaches recently. The costs and the security risks of running your software and systems on premise in terms of maintaining that, in terms of adopting new innovation. So comparing to moving to a cloud-based system that is more secure and that also reduces costs and has innovative cost models where you can just pay as you go. So the talk's about focusing on use cases, in particular patient education, surgical planning, and collaboration. So let's get into it. So I'll start with patient education. On the right-hand side, I don't know if any of you have seen this. This is a great example of augmented reality. Who's got an iPhone? Got an iPhone, have a look at Insight Heart or Insight. There's a whole series of these. And these are medical explainers that create 3D augmented reality in the world and take you through typical procedures. In this case, the heart goes through cardiac infarction and atrial fibrillation. They've also released kidney, liver, prostate. They've got it available on the Apple Vision Pro as well. But it's a great example. Have a look. Much richer experience than looking at a PDF leaflet in your waiting room. On the left side, Body Uncovered. How many people saw this series on the BBC? No. Okay, it's still on there on iPlayer if you want to have a look. I'll show you a short clip of that and you'll get to see what I'm talking about. In the middle there, I've got HoloMedicine from Apocular Medical, who I'll be talking about in a bit more detail. I'll leave that for a sec and just show you a quick clip from Body Uncovered. We're getting sound? We get... There we go.
A serious condition. Up here, having seen her mum's health deteriorate, Kirsty is also keen to know what's going on.
So Tina, we're about to see your spine. Are you ready for this?
I'm so excited.
I'm watching her and seeing how excited she is about it.
Good on you, Tina.
And just also, you've got that,
Jackie, she doesn't fall over.
yeah. Shall we put our headsets on?
Okay. Oh, gosh. Oh, wow. Absolutely awestruck at what I'm seeing.
This is your skull and this here is your spine.
Wow.
So this is what's been causing all of your problems.
Gosh, I have never seen anything like this. I just can't believe that's my body.
So
Okay, now, granted, that is high quality broadcast, but I can assure you that on the HoloLens, it was equally impactful. This was custom built at Imperial College, taking the medical data and producing that in 3D and then using that as a way of engaging the patient in their own pathology and own anatomy to better understand the risk. Now, what I'll show you next, moving 2 years forward, through Popular Medical, you can do this automatically now and provide this kind of experience, democratize that experience so that every patient can have an informed decision and actually see surgery. I don't know who watches The Good Doctor or one of those TV programs. Yeah, I love that show. But have you ever noticed they go up to the patient and show them the diagram scan and explain? It's like, really? They're going to understand that? So, this is potentially a way of really getting some comprehension and understanding the risks. So I'll just run a little teaser video. Okay, so that went a little quickly, so I'll slow it down a bit. I'll run another little video with a bit of narration this time, and then I'll talk more about the use cases.
Welcome to the future of medical care. Now you can gain an almost X-ray vision perspective of a patient's unique anatomy and pathology before an incision is even made. With 3D mixed reality, you can visualize DICOM files such as CT or MRI scans, but also 3D medical objects like pre-segmented STL files, now allowing you to superimpose these files on top of the real world around you. Doctors can instantly visualize individual anatomical structures like bones and vessels. BSI Holomedicine by Apoclar is a medical mixed reality platform. It enables surgeons across various medical fields to have the power of 3D surgical planning, meaningful collaboration, patient education, medical training, and education. Using Microsoft's HoloLens 2, surgeons can transform otherwise flat medical data sources into interactive 3D holograms. And together with 5G connectivity, both rural and urban clinics will have access to this technology. Doctors, professors, and students can work together in the same room or over distance with Microsoft Teams or with virtual avatars in the medical metaverse.
Okay, so I'll talk a little bit more about these. So essentially, what we're doing here is taking 2D DICOM slices, uploading them into the cloud, turning them into 3D volumetric objects that are then streamed down to the device where you can interact with them naturally. You can make them larger, look at those anatomical structures, have a look where the tumor is related to the important structures like the veins and the vessels, etc. Plan your surgery in terms of the margins of error, particularly for oncology. Ultimately, superimpose that either for learning on the mannequin or a cadaver, but also interoperatively, we're seeing surgeons start to do that and getting some amazing results, particularly if you can. It's the holy grail is to be able to use image-guided surgery and reduce the need for example, radiation if you need to continually re-image and know where you are. So the Apocular platform covers various use cases we're touching on. We've looked at patient education, surgical planning, and collaboration. Some features I'll touch on here. So we've got AI segmentation. So taking those CT scans that you can slice in at any angle, that's one level of planning and visualization, but actually turning those into segmented models where you can actually visually see all the structures in the tumor. And so this is done by incorporating AI models, and there's a series of models been incorporated, starting with liver and then lung and other models to be able to then do that automatically. So typically now you might have to do that manually, so it doesn't get done except in the most complex cases. So every patient is unique. So how do we democratize this and make it available to everyone cost effectively? We've got resection planning tools to be able to determine the resection plane, calculate the area of tissue, particularly important in transplant, where you want to, in liver, for example, where you want to know the amount of viable tissue. In the middle, you see some natural rendering. So that's actually automatically rendering the anatomy and giving you a rich visual experience. This is going to be quite interesting for head and neck, where you've got complex structures near the nerves, for example. So working with a NT surgeon doing parotid surgery, and the tumor is located near the facial nerve, which is a high risk of paralysis if something goes wrong. So that surgeon was able to do the planning using the visualization tools, but also create a video and create an immersive experience for the patient to explain the risks. So that was at UCLH. And then this is an example of what's coming in terms of registration. So using the AI tools to actually automatically recognize the anatomy and then superimpose the CT scan in this case, or in the segmented model in case on the right, and then semi-automatic because at the moment it's difficult to do for structures that are variable. So, for example, if you're doing orthopedics with hip and things move around, this next method is using a way of placing that by choosing 3 to 5 markers on the model and then 3 to 5 on the patient. I'll just skip ahead. It's not moving ahead. Okay, we'll see it in the video later, but basically, once you choose those points, it then registers on the actual anatomy. Okay. So this video, I'll just play a quick clip. This is actually using the technology to collaborate between hospitals.
After the successful first surgery performed in Serbia supported by HoloLens, the best practice continues. For the first time, doctors from Serbia and Malta have performed real-time collaboration. Remote medical consultation has been enabled in University Hospital Center. HoloLens technology enables blend of digital and physical world objects.
Kada donosimo važne odluke, kada imamo dileme, kada treba da se konsultujemo sa kolegama koji nisu tu, a možemo da ih vrlo brzo privedemo onome što mi vidimo, što mi čujemo, osjećamo, a kroz virtualne snimke, kroz mešanu realnost koju ovaj uređaj kreira, možemo da ih uključimo u ceo slučaj.
Upotrebom paralelno u našem vidnom polju operativnog polja i svih dijagnostičkih metoda kao što su kompjuterizovana tomografija, magnetna rezonanca.
I won't run through the whole thing, but I'll send you a link. But it's an example of how you can collaborate between hospitals, bring expertise to where it's needed, be able to collaborate immersively in the surgical planning, but also stream the first-person view so that the remote party can either supervise or learn from watching an experienced surgeon perform the surgery.
I sve.
I'm just conscious of the time, but running more videos, but I'll leave this one for view later. This is a great one from Nicholas Children's Hospital where they used the technology to inform a young patient of a heart operation, but also in the planning process where they could overlay and practice the surgery on a 3D printed model, which is worth watching. It's quite heartwarming. Very American, though. I shouldn't say that. It's not culturally appropriate. Sorry. I can say it. I'm Australian. Yeah. Okay, I want to focus now more on the education and simulation use cases. So again, talking about some of the challenges. Some of the research showing that 48% of students don't believe their knowledge of anatomy is adequate. Why is that? I mean, getting access to anatomy labs can be difficult. Some medical schools don't even have labs. Cadaveric labs in particular are very expensive. They're biohazards. I know of some medical schools, even in the UK, who just learn from basically books and maybe an app on the PC. So it's no wonder. 70% say that they're actually using XR as advantageous. We're seeing lots more of the use of this for anatomy training. In the US, Case Western rolled out HoloLenses during the pandemic to all their anatomy students. They're actually moving away from cadaveric training for the reasons I said before. And they're finding they're getting better results actually in terms of engagement, in terms of retention and exam results. And they were able to continue anatomy training remotely during the pandemic, and they continue to use this kind of these tools. And so, yeah, there's no reason why it can't augment the existing medical programs. And 74% undergrads express a desire to scrub in. So I hear this a lot talking to medical schools that students don't get a chance to actually go in and see what's going on in the hospital. And if they do, they're often like 5 deep in a ward round, so you don't really get a good view. So, yeah, can use these tools to actually improve that. So some of the other challenges for trainees, the fear of making mistakes and developing the clinical skills is quite high. So how do you give opportunities to practice and in a safe environment, grow your confidence and competence? There is also good research to show if you're supervised by an attendee, there's fewer complications, fewer errors that take place. So, what are the tools that allow you to do this more often? Imperial College did a lot of research. I'm sure, I know Leeds are also doing a lot of research. So I'm just sharing. This is from my friend James Kinross down there. He did a lot of work, particularly during the pandemic, where they used the technology to keep staff safe. And that kicked off a lot of these type of use cases, including at Leeds, where you send one person in with a head-mounted display device, in this case, the HoloLens. They would be one person with PPE, the rest people on Teams. And they actually found they significantly reduced the incidence of COVID for the staff. They were able to dramatically reduce the amount of PPE, obviously, but also the ward rounds were more efficient. They could take notes. People watching could take notes. You could push medical information into the field of view of the attending person in the ward round. They also did studies in terms of the effect on errors and found a few errors, albeit a small sample size there. They've also done some research around other use cases like instrument selection. I know they did some work on simulation training and scenario training. And they undertook some ward rounds with the platform with the University of Michigan. I know Alder are still doing this. I'm not sure if Leeds are actually doing this still, but variations of this kind of theme have been occurring around different medical schools and teaching hospitals. I mentioned University of Michigan. They've actually created a suite of online guides which are mixed reality guides for their nurses to train. And this is quite powerful. They are able to mix step-by-step instructions with the physical hands-on simulation labs. And the important thing about this is the students are able to build up their experience in a self-directed way, and that reduced the staff time by 70%. So that was quite effective, and the students still had 100% pass rate, high satisfaction and engagement. I often talk about, who's heard of the Ebbinghaus curve effect? Yeah. So we forget most of what we learn after a day or two. So AR, XR is a way of really helping move that up the curve. Why? Because it creates a rich multisensory experience that helps you with retention. As we saw in the last example with University of Michigan, which is, I think, explaining the results that you get. But also, there's a thing called cognitive load and cognitive distance, which you may be aware of. You learn something and then you apply it somewhere else in the field, for example. So that's cognitive distance, and having to remember all that information and applying when you need it, cognitive load. So this kind of technology allows you to bring that information into your field of view when you need it, so you can reduce the load and the distance and be more effective, particularly in the frontline workers. Whether you're frontline staff in nursing or whether you're at the operating table as a surgeon, being able to access and refer to the information when you need it is quite important. Another example of the use of this technology, this is in this time it's University of Florida. They've actually blended cadaveric training with the holographic training technology. And I'll run a quick video, but interestingly, they've actually given these tools to the students as well, who can present back their learning.
artery, axillary, lateral edge. Distally, the brachial artery, which bifurcates into the radial arteries. So let's see if we can find those same structures on our video. Now, as I mentioned before, here we have the aortic arch, which gives rise to three main branches going from the right to the left. The brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. The brachiocephalic trunk gives rise to two more branches, the right common carotid artery and the right subclavian artery. That right subclavian artery eventually merges as the right axillary artery.
They thought they were getting an anatomy lesson today. So this has just been streamed over Teams, so the anatomy lab host can reach a wider audience. But it can also be given into the hands of the students as well to augment their learning and do self-directed learning. So you can see the multimedia aspect of it. So both use cases can be, both ways can be enabled. So this could be done by the instructor and stream the view, so they would see it on 2D. Or if they were wearing a headset, you could be immersed and actually interact with it. And I'll show you some examples of that. But you get the idea. You're combining complex anatomy on the cadaver with a 3D. So the students actually learning also how to interpret CT scans and MRI scans as well, which is a skill to develop. Just quickly, this is Dr. Gao from Singapore.
And we linked up surgeons from Singapore, Nepal, Japan, and India in what you can call a healthcare metaverse. And everyone was on a HoloLens device in their respective countries. They were all linked together.
So this is to your question, Laura.
Actually, a case discussion just purely on the HoloLens, looking at the 3D images, wherever they are. So taking that 2D remote assistance, remote proctorship up a level into the 3D metaverse space. Education and training, right? This is where it's going to be very useful for residents, medical students, graduates, undergraduate teaching. This is Professor Bonnie, who was taking some residents through a liver resection tutorial, teaching them how to appreciate the liver anatomy in 3D. And you can see all the residents were wearing a HoloLens, and they're doing essentially a multiplayer session, and they're all looking at the same image. We use it for patient counseling as well. So especially for more complex surgeries, right? It's difficult to explain to them on the computer screen when you're scrolling through a CT scan or MRI scan or drawing it on a piece of paper. So what we do is that we segment out the scans for them, show them their own holograms, and the entire operative counseling is done with the patient and the surgeon wearing the HoloLens. And we find that the patients actually have a lot better appreciation and a lot better understanding of their surgery, especially those that are more complex. When you tell them your tumor is very near a blood vessel, which is why there's a high risk of you bleeding, right? To the patient, they may not understand why it is, but if we show them how close it is, then they appreciate, okay, this is why my surgery is going to be a bit more complex than another one. So
Dr. Gao is a liver transplant surgeon. The hospital is one of the biggest deployments of this technology. They actually deployed it securely on 5G, so the surgeons can put the headset on and get low latency instant access to the medical data. But they're using it for various operations, looking at planning liver surgery, using it to identify which route to go in for thoracic surgery. You saw an example where they're overlaying the brain on the actual head. So there's a lot of different use cases for this kind of technology, interoperably and surgical planning, as well as the areas that Dr. Gao talked about there. So the platform from Popular Medical is intended to cover the whole spectrum of learning from preclinical all the way through to professional learning. And it's a blend of the mixed reality as well as the virtual reality. And I'll talk a bit more about the virtual reality now, which is totally immersive. So the virtual reality platform is something called Spaces. It's basically a multiplayer metaverse environment where you can come in as an avatar from anywhere in the world and go into that space and interact with the content that's in that space. That content could be any sort of content, could be 3D content from, say, anatomy. It could be actually the pathologies. So this is connected to their clinical engine. So you can bring in actual patient anonymized 3D rendering of CT and MRI scans and use them in a learning environment. Also, you could bring in 360 videos and immerse yourself in that. Could be 2D information as well, video screens, presentations. You basically creating a virtual space to teach from. Here's a quick example of the 360 video. This was created by a surgeon, head and neck surgeon at UCLH, who's running masterclasses. So as well as the 360 video, you can combine the actual 3D model of the segmented, in this case, parotid surgery, and you can talk through. It's been used, various models. So one model which is interesting is actually we've seen MedTech sponsor a series of masterclasses, so that could be one way. But also putting tools in the hands of the creators to use this space to upload their own content and curriculum and then deliver classes. In this case, other examples, so this is a DICOM viewer. Also AI, so being able to animate avatars and have interactions with them, whether that could be an avatar AI bot talking about the environment, talking about maybe how to use a bit of equipment, but also it could be used to simulate patient interaction. So one of the challenges is clinical reasoning and practicing in a safe environment. So that's another way that the AI bots could be used. And someone I was speaking to earlier was telling me the challenges there, that make sure it's got guardrails, and that's a very important point, that these AI bots need to be properly trained and guardrails associated with them. Some example rooms there. So these rooms are available to use, but they can also be configured for the institution who wants to use them, or custom build a room specifically. The vision for this actually is to also bring in the live scene from the hospital. So it'd be interesting to talk to Oliver about the viability of this. We're already starting to look at this, but live streaming not only medical information in first person view, but a 3D rendering of the actual theatre. So you can't get into the hospitals as a student, so bring the hospitals to the students is the direction we're trying to go, but also for proctoring, bring an expert in to oversee the surgery. So that's going to be an interesting development in the next few years. So just quick, recently ran a collaborations session on this environment between Korea and Singapore and Germany. And here's another example. That was an ICU room where they're practicing clinical reasoning skills. You've got an endoscope machine. You could create training on how to use that. You could animate the patient to interact with them on a particular case, and you can bring in their pathologies. This is that as a quick tour of the room. But if anyone wants to see this, we've set it up in the Helix. So whether we've got time today or tomorrow, but in the future, it's something that we can also share. Okay, I talked about Popular Medical mostly, but here's a couple of other startups I've been working with, and this one is actually known to Leeds. So Faisal knows them well, Fracture Reality. They built some really interesting, what I call Mechanical Turk style AIs. So anyone know what Mechanical Turk is? Yeah.
Meet Stacey, a virtual patient.
Actually, before I run these, I should say the second one's quite powerful. It's a lady who's lost their baby. So, parents in here, I think even though it's an avatar, I find it quite powerful.
She is presenting with symptoms and signs in keeping with an acute mental health illness. Learners meet her in a private consultation room in the hospital.
Hello, Stacey.
Does everyone know about this, or?
I've been asked to speak to you a little bit about how you've been feeling recently. So it'll involve me asking.
They conduct a mental health assessment and try to make sure that she gets the right care. After the simulation, learners watch and evaluate the recording with the instructor.
Stacey knew that they were going to ask about that.
Join XR allows students to practice face-to-face communication in non-routine encounters with realistic digital patients.
If something goes wrong in this consultation, it is just a simulation and they can learn from their mistakes without there being consequences.
I'll just run this one as well. But what you see there is it's not actually an AI. It's facilitated. So an expert host would choose the responses of the avatar, but the student feels like they're actually speaking to a real person or an AI. Now, the next evolution of this would be AI chatbot, but to the point before, want to make sure that it's not hallucinating and giving appropriate responses and probably constrained. But still quite a powerful tool for learning and practicing in a safe environment. Yes.
Yeah, so this application now is being trialed by the School of Healthcare at the university. So we run the initial evaluation now. They are trying to embed that into the curriculum.
Thank you. Another example, they've got a suite of these. They've got palliative care, conversations. Sorry, question?
Oh no, it's just that one. There's a preset amount of recorded responses which the actual patient themselves, or is it with an actor?
No, it's not an actor. So it's a CGI animation that's animated by these phrases that have been chosen based on clinical evidence. So it's typical responses, and it's really the learning takes place actually after the conversation, because you record the conversation, the interaction, and then you as a group discuss sorry, go Faisal.
The responses are instructor driven. So the instructor sees the whole sort of storyboard as possible before the avenues of conversation quickly go down, and they then select from those in real time as the trainee is having a conversation.
So the trainee interacting comes in response, they say the trainee says something, and then the person listening in instructor goes, this one.
That's right.
It's like, I don't have a response to this. And then it's like,
yeah. And so it takes a little bit of practice to be quick at it. So it's a kind of a mechanical Turk or Wizard of Oz kind of thing. But as a student, it actually is amazing how quickly you think you're actually speaking to someone.
Yeah. We trained up students to be able to sort of control the avatar. About sort of 4 or 5 sessions, they felt very comfortable being able to sort of elicit responses in a sort of smooth sort of fashion that led you down a sort of path to that education.
A halfway point with AI might be to use AI to choose the responses out of the selected set. That could be something. Do you want to see a little bit of the next one or move on? Just quickly play it. This one's quite powerful.
I'm sorry things are so hard right now, Mira.
Could you just sit with me, please? It's hard to make sense of anything right now.
Could you tell me a bit about your daughter?
Her name was Amelia. She's perfect.
you imagine it's difficult to, practice those kind of conversations. I had I was at the British Transplant Institute, and they came up with a use case I didn't think of. But if you're having a conversation with an organ donor's family, for example, how do you practice having that conversation? So, using these type of tools to be able to do that in a safe environment. But also, what I showed you before with avatars in a virtual space, that you could actually role play, even if it wasn't a AI bot, you could actually role play in a safe environment as well. So it's interesting applications of these tools for complex conversations, not only medicine, but any kind of interaction. Another area I've been working on, which kind of moves away a little bit from the topic area, but I thought I'd throw it in since we've got a few more minutes, rehabilitation. So I'm working with this startup who've actually got electronic muscle stimulation. If you've ever been to the physio, and you might have had this on your to help you with recovery and build up muscle mass. So they've actually created a consumer version that they pair with a fitness app. So you can actually, as you're doing your fitness, you can feel the muscles working, and actually is proven to build up muscle mass. So applying that in a clinical sense is quite powerful in terms of rehabilitation. So you can have a VR-based rehabilitation and build up your muscle. So this is an interesting one I want to talk to Rory about, actually. And then the final one is another startup I've been working with, and I love showing this because this really shows the impact of mixed reality on patients' lives. And I'll just run the video, but essentially it's using mixed reality to help train new neural pathways, in this case for Parkinson's patients, but they're also working with stroke and multiple sclerosis, and also using that on the patient themselves, not only to do rehab exercises, but using something called visual cues that overcomes freezing episodes for Parkinson's patients. So I'll just run the video because I think it's quite cool.
In the year. Yeah. I'm sure, yeah.
So he's doing the exercise on the right. They're basically putting virtual objects in the world that he's stepping over.
Wow, look at that.
So look at him get across the room.
How do you feel? Incredible. Incredible. This is so amazing what's done to some of the bed here. If you lose one now, you know where it's gone, right? It's just fantastic. You see the boys in together, and it's just amazing. I think it's wonderful. I really do. I think it's absolutely great.
I think it's brilliant.
Nice help. In your car, you don't have to come out of your own front room. It was good getting back to something that I remember doing.
We now can see how to really be part of our clinical service on a day-to-day basis. With regards to the exercise games that are available, they were fun, they were easy to follow, and all very relevant to some of the impairments that we are trying to tackle with Parkinson's.
So that's another one that Leeds University is actually part of the trial. And they recently won a grant, I think, to take this to stage 2. And it's 3 o'clock. Probably should wrap up. So there's plenty of reading to follow up on. There's a new paper from the Future Care Capital, if you want to learn more. And a plug for the Whole of Medicine Association as well. So thank you very much for your time.
Thank you very much, Joe. Questions? I'm not sure. There might be some questions in the chat.
Okay.
Just have a look, see it on there. So one of the sort of key things I think here in the sort of barrier to adoption is a demonstration of the sort of return of investment. So you have a lot of sort of startup sort of expensive kit, often if it's AR devices in particular. Is that something you know of sort of taking place right now? Is it sort of something that needs to be done soon?
In terms of which part, the return on investment or the cost of the device?
Yeah, so you've got these different
Yeah.
sort of departments, different sort of use cases, and each one of them needs to know whether the current way or some other alternative or this version is going to be the most cost effective for them in the long run. And so is that the type of work you've been undertaking?
Yeah, it is something that is a challenge. We've been kind of gathering, some of this evidence, and some of it's available on the Holomedicine Association. On the Popular website, there's pointers to a lot of studies and research papers in PubMed in terms of the efficacy. In terms of ROI models and business cases, I think there's probably could be more that takes place. The HoloLens was an expensive device, very in order to get scale adoption, you need to be quite a healthy business case, and it's difficult for schools and health to be able to adopt it at scale. So I think you need to look at a blend of experiences. So, for example, being able to have a facilitator use a high quality top-end headset, be able to actually have the others participate, maybe over Teams, for example, as a way to scale the experience. But we're also seeing the cost of headsets come down. So I think that's starting to get better. So Meta headset, for example, for a virtual environment, is what is it? You can get into a Meta headset for like 500 compared to a £3,000 HoloLens. Yes, it's a different device, but you can tackle a lot of the use cases with cheaper headsets, and that's only going to get cheaper and cheaper. But yeah, I think have to look at where you're seeing the value. So, for example, in surgical planning, one obvious area is this 3D printing. There's a cost associated with it, and the time it takes to actually do a 3D model. It can be very effective, but can you do it for everyone? Can you actually do it quickly? Can you refer to it in surgery, because it's it needs to be in a sterile environment and you want it in your field of view. So what's the can you put a price around that in terms of the value to justify the investment? So this is where it's a long answer to your question. I think more is required, and I'd appreciate any assistance Leeds University wants to give.
Yeah. It's a question we've been thinking about a lot, actually.
Yeah.
We can talk about that more. I'm just conscious of time, so I wonder if we've got any point to ask your question. You just beat Max. Sorry, Max. We'll keep that later. Yeah.
Because you've been involved in so many different efforts in healthcare and AR, right? So, is there a technical challenge that keeps popping up? Something that comes to mind? Everybody in different applications seems to have the same technical problem.
Okay. So the one that in surgery, in the surgeons, the big one that the holy grail, as I called it before, is registration. If you can register the objects reliably, accurately, you can reduce costs significantly in terms of the equipment, because there's navigation software now, which is very expensive in the millions and hardly gets used because it takes time to set up. And radiation, exposure to radiation is a big thing. So you can justify the cost if you can do that. So that's probably the big one to make.
Excellent. Okay. So we will just have to stop there. So hopefully, Max, you'll get a chance to chat with Joe afterwards.